This is Professor Capron. Welcome to today's presentation on theories of development. By the end of this presentation, you will be able to compare and contrast major developmental theories, understand the stages of development in each theory, and reflect on the application of developmental theories in nursing practice. Please pause the video and take some time to make sure you understand these key terms and their definitions. Freud's psychoanalytic theory emphasizes the influence of the unconscious mind and early childhood experiences on development and behavior. According to Freud, much of our behavior is driven by unconscious motives and conflicts, often stemming from childhood. These unconscious elements shape our personality and behaviors in significant ways. The unconscious mind consists of thoughts, memories, and desires that are not within our conscious awareness but still influence our actions and feelings. Early childhood experiences are critical as they lay the foundation for future behavior and personality. Freud believed that unresolved during early stages of development could lead to psychological issues in adulthood. Freud proposed that children pass through a series of psychosexual stages, each characterized by the pleasure-seeking energies of the id, part of the unconscious mind, focusing on different erogenous zones. Successful navigation through these stages is crucial for healthy psychological development. You will hear a lot of criticisms of Freud as you go through your studies. There are some flaws in his theories, and you'll probably hear plenty of your instructors say, not a fan of Freud, guy was a pervert, because he was. But you still need to know this material, and there is some validity to it. The oral stage is from 0 to 18 months. The focus is the mouth. Activities are sucking, biting, and chewing. The conflict is weaning from the breast or bottle. During the oral stage, an infant's primary source of interaction occurs through the mouth, so the rooting and sucking reflex is especially important. The mouth is vital for eating, and the infant's pleasure from oral stimulation through activities like tasting and sucking. Overindulgence or frustration during this stage can lead to oral fixations in adulthood, such as smoking, overeating, or nail biting, highlighting the long-term impact of early experiences. The anal stage, according to Freud, was 18 months to 3 years, with a focus of the anus and activities toilet training. The conflict is control and regulation of bodily needs. In the anal stage, Freud believed that the focus of the libido was on controlling bladder and bowel movements. The major conflict at this stage is toilet training, and the child must learn to control bodily function. Success or failure at this stage can result in an anal retentive personality, obsessive, rigid, or an anal expulsive personality, messy, disorganized, demonstrating how early childhood experiences shape personality. Freud considered the phallic stage to be from 3 to 7 years. The focus is genitals. Activities are exploration and curiosity about body parts. Conflict is the Oedipus complex, or alternatively for females, the Electra complex. During the phallic stage, children become aware of their bodies and the differences between male and female anatomy. Freud introduced the concept of the Oedipus complex for boys and the Electra complex for girls, where a child feels a sense of rivalry with the same-sex parent for the attention of the opposite-sex parent. We'll often see children at this stage say, "Mommy, when I grow up, I'm going to marry you." So you have to explain to the child that no, they're going to grow up and they're going to find someone specifically for themselves. Resolution of these complexes is crucial for developing a healthy adult identity and sexual orientation. The latency stage, 7 to 12 years, the focus is on dormant sexual feelings. Activities include social interactions and intellectual pursuits. The conflict is the repression of sexual urges. Again, this is according to Freud. The latency stage is a period of relative calm where sexual impulses are repressed and the focus is on developing social skills, hobbies, and friendships. Freud believed that this stage is essential for consolidating earlier stages and developing a sense of self. So this stage allows children to expand their world beyond the family and develop a stronger sense of social identity and self-esteem. And then the genital stage, 12 plus years, with the focus on genitals, the activities being mature sexual interests, and the conflict being balancing sexual desires with social norms. The genital stage is the final stage of psychosexual development, starting at puberty and continuing into adulthood. The libido is active again, and individuals seek to establish mature sexual relationships. Successful navigation of this stage leads to well-balanced, warm, and caring individuals. Healthy resolution of this stage is marked by the ability to balanced and fulfilling relationships, integrating earlier psychosexual stages. Freud's psychoanalytic theory and its stages of development emphasize the profound impact of early childhood experiences and unconscious processes on personality and behavior. Each stage focuses on different erogenous zones and conflicts, shaping how individuals navigate and resolve these conflicts. So, understanding these stages provides valuable insights into the development of personality and psychological well being. Erikson's theory emphasizes the significant influence of social and cultural factors on human development. Unlike Freud, who focused on psychosexual stages, Erikson proposed that development continues throughout the entire lifespan and is shaped by social experiences and challenges. Each stage in Erikson's theory represents a crisis that must be resolved for healthy personality development. I'm not going to lie, I'm an Erikson girl. I absolutely love his theories, and I feel that they are incredibly important for your understanding of how to assist your patients throughout their lifespan. So the stages of development, we start with trust versus mistrust. This is infancy, basically birth to about a year. During this stage, infants learn to trust their caregivers to meet their basic needs. Trust is developed when caregivers are responsive and consistent in meeting the infant's needs for food, comfort, and affection. If caregivers are neglectful or inconsistent, the infant may develop mistrust, feeling insecure and anxious about the world. So, establishing trust is foundational for a sense of security and forms the basis for future relationships. Autonomy versus shame and doubt is the toddler stage, basically about 1 to 3 years. Toddlers learn to exercise their will and do things for themselves, or they doubt their abilities. Autonomy is when caregivers encourage self sufficient behaviors such as dressing, feeding, and toileting. Overly critical or controlling caregivers may cause children to feel shame and doubt in their abilities. Encouraging autonomy helps children to develop a sense of independence and confidence in their abilities. Next is initiative versus guilt, the preschool years. This is basically ages 3 to 6. In this stage, children assert themselves more frequently. They begin to initiate activities, plan tasks, and engage in imaginative play. If given the freedom to explore, children develop initiative. If they are overly controlled or criticized, they develop guilt about their desires and suppress their initiative. Fostering initiative supports children's ability to take leadership roles and engage in creative activities. Industry versus inferiority is the school age years, basically 6 to 12. Children need to cope with new social and academic demands. Success leads to a sense of industry or competence, while failure results in feelings of inferiority. Encouragement from parents and teachers helps children to develop a sense of competence in their skills and abilities. Criticism or lack of support can lead to feelings of inferiority. Develop industry or industriousness prepares children for future challenges and instills a sense of achievement. We move into identity versus role confusion in the adolescent years, basically 12 to 18. Adolescents explore different roles and ideas to form their personal identity. Success in this stage leads to a strong sense of self and direction. Failure to establish a clear identity can result in role confusion and uncertainty about the future. Solid identity provides a stable foundation for making life choices and developing a sense of self. Intimacy versus isolation or young adulthood is next, right around ages 18 to 40. Young adults need to form intimate, loving relationships with others. Success leads to strong relationships, while failure results in loneliness and isolation. The ability to form close relationships is based on a secure sense of identity. Successful resolution of this stage fosters deep connections and supportive relationships. Agility versus stagnation is the middle adulthood years, basically 40 to about 65. Adults need to create or nurture things that will outlast them, often through parenting, work, or community involvement. Success leads to feelings of usefulness and accomplishment, while failure results in shallow involvement in the world. Generativity supports the well being of future generations and provides a sense of purpose to the client. Finally, we have ego integrity versus despair, or older adulthood, which is basically ages 65 years and up. As people grow older, they reflect on their lives and feel a sense of fulfillment or despair. Success at this stage leads to feelings of wisdom and acceptance, while failure results in regret, bitterness, and despair. Achieving ego integrity allows individuals to face the end of life with a sense of completeness and satisfaction. This understanding of Erikson's psychosocial stages highlights the continuous interaction between individual development and social influences and emphasizes the importance of each stage in forming a well rounded, healthy person. Now let's discuss Havighurst's developmental tasks, which focus on the critical tasks that individuals need to accomplish at various stages of their lives. Understanding these tasks helps us to appreciate the challenges and goals that people face as they grow and develop. Havighurst's theory emphasizes that development is continuous throughout the lifespan and involves a series of tasks that must be achieved at each stage for optimal functioning. These tasks are influenced by biological, psychological, and socio-cultural factors. In infancy and early childhood, the key developmental tasks are learning to walk, talk, and take solid foods, developing physical control such as bowel and bladder control, forming concepts and understanding language to describe social and physical reality, learning to relate emotionally to parents, siblings, and other people, and establishing a sense of autonomy and beginning the process of self control and self concept formation. The key developmental tasks of middle childhood involve learning physical skills necessary for ordinary games and activities, building wholesome attitudes toward oneself as a growing organism, learning to get along with peers and developing friendships, developing basic academic skills such as reading, writing, and arithmetic, developing a sense of morality and values, and achieving personal independence and acquiring skills necessary for everyday functioning. In adolescence, they need to achieve new and more mature relationships with peers of both sexes. They work on achieving a masculine or feminine social role and accepting one's physique and using the body effectively. They're preparing for an economic career and achieving emotional independence from parents and other adults. This helps them to be preparing for marriage and family life and acquiring a set of values and an ethical system to guide behavior, developing an identity. In early adulthood, people are selecting a mate and learning to live with a partner. They're starting a family and managing a home and establishing themselves in a career. They're taking on civic responsibilities and finding a congenial social group. And they're continuing the development of emotional stability and a lifestyle. In middle age, they begin assisting their teenage children to become responsible and happy adults. They're achieving adult social and civic responsibilities, reaching and maintaining satisfactory performance in one's occupational career, developing adult leisure time activities, relating to their spouse as a person, and accepting the physiological changes of middle age and adjusting to their own aging parents. In later maturity, they're adjusting to decreasing physical strength and health, adjusting to retirement and reduced income, adjusting to the death of a spouse and establishing an explicit affiliation with one's group, adopting and adapting social roles in a flexible way, and establishing satisfactory physical living arrangements. By understanding these developmental tasks, we can better appreciate the specific needs and challenges individuals face at each stage of life. This knowledge is crucial for providing appropriate support and interventions to promote healthy development across the lifespan. Now let's discuss Jean Piaget's theory of cognitive development. Piaget was a Swiss psychologist who studied how children acquire knowledge and learn. His theory is a cornerstone in understanding childhood development and has significant implications for education and parenting. Piaget's theory is divided into four distinct stages, each representing different ways that children think and learn about the world around them. Let's break down each stage. The sensory motor stage is from birth to about 2 years. During this period, infants learn about the world through their senses and actions. They learn object permanence, or understanding that objects continue to exist, either be seen, heard, or touched. This usually develops around 8 to 12 months. They also learn motor skills. They begin to coordinate their sensory experiences with their motor actions, like reaching for a toy or crawling toward an object. Infants rely on sensory input and motor actions to explore and learn about their environment, and this lays the foundation for more complex cognitive processes. What Piaget called the pre-operational stage occurs from ages 2 to 7. Children begin to engage in symbolic play and learn to manipulate symbols, but they don't yet understand concrete logic. They have language development, rapid expansion of vocabulary, and ability to form sentences. This is crucial for communication and learning, but they are very much full of what's called egocentrism. They have difficulty in seeing things from perspectives other than their own. Children in this stage often think that others see, hear, and feel exactly as they do. This is when they begin to develop pretend play and engage in imaginative play, which helps to develop cognitive and social skills. Symbolic thinking allows children to use words and images to represent objects and experiences, which is essential for language development and problem solving. We then move into the concrete operational stage, which spans from ages 7 to 11. Children start to think logically about concrete events. They begin to understand conservation, which is understanding that quantity doesn't change even when its shape does. For example, realizing that water poured from a short, wide glass into a tall, thin glass remains the same amount. And classification, they grow an ability to group objects based on common attributes, such as sorting by size, color, or type. And then there's also seriation, which is the ability to order objects in a series, like arranging sticks from the shortest to the longest. Logical thinking about concrete objects and events allows children to solve problems in a logical manner, which is crucial for academic success and everyday decision making. The formal operational stage is from 11 years on up and continues into adulthood. Individuals develop the ability to think about abstract concepts. So they have the ability to think about hypothetical situations and other abstract concepts such as justice, love, and freedom. They have the ability to develop hypotheses and systematically test them to arrive at conclusions. This involves thinking logically and critically about outcomes. They also develop a deeper understanding of moral and ethical principles and how they apply to various situations. Abstract thinking and hypothetical deductive reasoning are essential for complex problem solving, scientific reasoning, and understanding advanced concepts in various academic subjects. So understanding Piaget's stages of cognitive development helps in recognizing the capabilities and limitations of children at different ages. It also guides them in how to support and enhance their learning and cognitive growth effectively. This framework is very important for educators, parents, and healthcare providers. Levinson's life structure theory emphasizes the evolving nature of life structure, which includes the patterns and frameworks that define an individual's life at any given time. Life structures are influenced by personal relationships, career, and physical health, and they shift and change as individuals transition through different phases of life. During the early adult transition phase, basically 17 to 22 years, individuals move from adolescence into early adulthood. This period is marked by significant changes such as leaving home, starting higher education or vocational training, and beginning to establish a personal identity separate from their family. Primary task is to form a stable identity and prepare for future roles in adult society. In the entering the adult world phase, about 22 to 28, individuals start to make more permanent choices regarding their careers, relationships, and lifestyles. This is often a period of high energy and ambition as individuals strive to establish themselves in the adult world. They may face the challenge of balancing personal aspirations with societal expectations and responsibilities. The age 30 transition, which can be from anywhere from 28 to 33 years, is a time of reflection and reassessment. Individuals evaluate the choices they have made so far and may make significant changes to their life structure. This phase often involves questioning past decisions and making adjustments to better align with personal goals and values. It is a critical period for ensuring future stability and satisfaction. During the settling down phase, about 33 to 40 years, individuals work towards consolidating their life structures. They aim to achieve stability and continuity in their careers, relationships, and personal lives. This period is characterized by a focus on long-term goals, such as career advancement, home ownership, and raising a family. The challenge here is to maintain balance and prevent burnout. The midlife transition, about 40 to 45, is often marked by a period of self examination and reevaluation of life's direction. Individuals may experience a midlife crisis where they question their achievements and consider making significant life changes. This can be a time of major transformation with a focus on personal growth and redefining life goals. In the entering middle adulthood or 45 to 50-year phase, individuals begin to solidify the changes made during the midlife transition. This period involves coming to terms with aging, achieving a sense of accomplishment in personal and professional life, and preparing for the future stages of life. The emphasis is on achieving a sense of fulfillment and leaving a legacy. Kohlberg's theory of moral development is pivotal in understanding how individuals evolve in their ethical and moral reasoning. This theory primarily focuses on the progression through different levels of moral reasoning, which can be observed in both children and adults. It is essential to grasp that this theory does not merely categorize behaviors, but goes into the rationales behind moral decisions. The underlying principle is that moral reasoning matures and becomes more sophisticated as individuals grow older and gain more experiences. Each stage of development is broken down into two substages. So the pre-conventional level starts with stage 1, obedience and punishment orientation. At this stage, an individual's moral reasoning is primarily shaped by the consequences of actions. The focus is on direct consequences to themselves. Actions are deemed right or wrong based on whether they lead to punishment. For example, a child might think that stealing is wrong because it can lead to being punished. Stage 2 is individualism and exchange. Here, the perspective broadens slightly as individuals recognize that others also have their own needs and desires. Moral decisions are based on self-interest and reciprocity. An action is perceived as right if it satisfies one's own needs or involves a fair exchange. For instance, a child might help another child with the expectation of getting help in return. The conventional level is broken into two different stages as well. Stage 3, which is called good interpersonal relationships. Moral reasoning at this stage is influenced by social expectations and relationships. The focus is on being perceived as a good person by others, and actions are guided by the desire to maintain positive relationships. Approval from peers and authority figures is highly valued. For example, a teenager might follow school rules to gain praise from teachers and avoid disapproval from friends. Stage 4 is called maintaining social order. Individuals at this stage are concerned with maintaining law and order and respecting authority. They believe that rules and laws are crucial for the functioning of society and that it is important to uphold them to ensure societal stability. For example, an adult might abide by law strictly because they believe it is essential for societal harmony. Finally, we hit the post-conventional level, also divided into two different stages. So let's start with stage 5, the social contract and individual rights. Moral reasoning here is based on understanding that laws and rules are social contracts that can be changed when they do not promote general welfare. Individuals recognize the importance of individual rights and are willing to challenge unjust laws. For example, an individual might advocate for changes in laws that discriminate against minority groups because they believe in the principle of equality. Stage 6 is considered universal principles. At this stage, individuals are guided by internal moral principles that apply universally. They act based on principles of justice, dignity, and equality, even if it means going against laws or social norms. For instance, a person might engage in civil disobedience to protest against human rights violations, guided by their commitment to universal ethical principles. Understanding Kohlberg's stages of moral development is crucial in comprehending how moral reasoning evolves and how individuals make ethical decisions. These stages highlight the progression from a self-centered viewpoint to a broader perspective that considers societal rules and universal principles. This knowledge can be applied in various settings, including education, parenting, and healthcare to foster moral growth and ethical decision-making. Gilligan's theory of moral development was proposed as a counterpoint to Lawrence Kohlberg's theory, which was criticized for its male-centric approach. Carol Gilligan argued that men and women have different paths to moral development, and that women are more likely to base their moral decisions on relationships and their care for others. Her theory emphasizes the role of care and relationships in moral development, focusing on the unique perspective of women. So for her levels of development in the pre-conventional, we're talking about selfishness. At this initial level, the individual's primary concern is for their own survival and well-being. Decisions are made based on what is best for oneself, without much consideration for others. Actions are motivated by self-interest. The individual's needs and desires are prioritized over those of others, and there is little to no consideration of the impact of actions on relationships or the well-being of others. This stage reflects an egocentric view, where the individual's primary concern is to meet their own needs. Understanding this stage is important for recognizing the initial steps in moral reasoning where care for oneself is paramount. Then we move into the conventional stage, which focuses on goodness. In this stage, the individual starts to care for others and seeks to please and be accepted by them. The focus shifts from self-interest to responsibility and care for others. Actions are motivated by the desire to be perceived as good by others. The individual begins to balance their own needs with the needs of others, and there is an increased awareness of the importance of relationships and a desire for harmony. This stage reflects a transition from self-centeredness to a broader concern for others. It is crucial for understanding how individuals begin to integrate the needs of others into their moral decision-making process. At the post-conventional level, we are focusing on nonviolence. At this highest level of moral development in Gilligan's theory, the individual embraces the principle of nonviolence and prioritizes the care for self and others equally. Moral decisions are guided by the understanding of the interconnectedness of all people and the commitment to avoid harm. Actions are motivated by a commitment to the principle of nonviolence. The individual recognizes the interconnectedness of all things and all beings and the mutual impact of the actions. There is a strong emphasis on ensuring that decisions and actions do not harm others, and the individual strives to balance their needs with those of others, promoting equality and fairness. This stage represents the culmination of moral development, where care for oneself and others is fully integrated. Understanding this stage is essential for recognizing the highest form of moral reasoning, where actions are based on principles of care and nonviolence, ensuring the well-being of all. Gilligan's theory provides a unique perspective on moral development, highlighting the importance of care and relationships. It emphasizes that moral development involves not just justice and rules, but also compassion and understanding, especially from a female perspective. This theory is crucial for understanding the different pathways through which individuals, particularly women, develop their moral reasoning. Fowler's faith development theory is a framework that describes the stages of spiritual growth and development that individuals undergo throughout their lives. It emphasizes how people develop their faith, meaning making, and worldviews as they grow. Fowler's model is particularly significant in understanding the psychological and emotional aspects of faith that evolves over a lifetime. Remember that faith is not necessarily synonymous with religion. Bear that in mind as we go through this. So in the pre-stage, we have undifferentiated faith. In this initial stage, typically seen in infants, faith is not yet developed. It's more about primal trust, which is formed through the relationship with the primary caregiver. This trust lays the foundation for future stages of faith development. It's about experiencing the world through early attachments and basic interactions. The infant learns whether or not the world is a safe place. Stage 1 is intuitive projective faith, usually occurring between ages 2 and 7. This stage is characterized by imagination and the perception of faith based on intuition and images. Children in this stage are heavily influenced by stories, images, and feelings. This understanding of faith is often based on what they observe in their environment, including family, culture, and religion. They have an intuitive sense of the sacred, but it's mixed with fantasy and reality. Stage 2 is mythic literal faith. From around ages 7 to 12, children start to understand faith through concrete, literal interpretations of religious stories and symbols. They begin to separate reality from fantasy. This stage is marked by the ability to organize experiences into coherent stories and explanations. Religious beliefs are taken at face value, and the focus is often on moral rules and the literal truth of stories. Stage 3 is synthetic conventional faith. Typically beginning in adolescence, this stage involves a more abstract understanding of faith. Individuals in this stage start to internalize beliefs and values from their community and significant others. Critical examination. Faith becomes a synthesis of various elements from one's upbringing and environment. There is a strong need for belonging and acceptance from a community or group, and faith is aligned with group norms and beliefs. Stage 4 is called individuative reflective faith, usually emerging in young adulthood. This stage is characterized by critical reflection and personal responsibility for one's beliefs and values. Individuals begin to examine their faith more deeply, questioning pre-held beliefs and potentially redefining their understanding of faith independent of their community. This stage involves a greater level of self-awareness and autonomy in one's faith journey. Stage 5 is called conjunctive faith. In midlife or beyond, individuals in this stage start to recognize the complexity and paradoxes of faith. They become more open to the perspectives and truths of others, integrating them into their own understanding. There is a movement towards embracing a more inclusive and interconnected view of faith, where previous conflicts or contradictions in belief are reconciled. Stage 6 is universalizing faith. It is rare and usually seen in advanced age. Individuals at this level have a profound understanding of universal principles of compassion, justice, and love. Their faith is deeply grounded in the commitment to these universal values, often leading them to lives of selfless service. They see all life as interconnected and strive to embody the highest ideals of their faith tradition, transcending specific doctrines or practices. So, Fowler's faith development model provides a comprehensive framework for understanding how individuals grow and evolve in their spiritual beliefs throughout their lives. Each stage reflects a deeper and more complex understanding of faith, influenced by personal experiences, cognitive development, and social interactions. Understanding these stages can help in providing better spiritual care and support for your patients at different life stages. Now let's talk about the application of these different theories and frameworks in your nursing practice. Understanding the various stages of development proposed by these theorists, Freud, Erikson, Havighurst, Piaget, Levinson, Kohlberg, Gilligan, and Fowler, is crucial in nursing practices. These stages provide a framework to tailor nursing actions and interventions to meet the specific need of patients at different life stages. Let's look at how these can be practically applied in nursing. So for Freud, during the infancy or oral stage, knowing that an infant's primary interaction with the world is through the mouth, we should ensure that proper feeding techniques and monitor for signs of oral issues like feeding difficulties. At the toddler anal stage, the focus is on toilet training. We can support parents by providing guidance on toilet training practices and recognizing signs of readiness in the child. For Erikson, we know that in infancy, establishing trust is vital. We can promote trust by providing consistent, responsive care and ensuring a secure environment for the infant. Let's look at adolescents. Adolescents are forming their identity, so we should provide support in exploring their interests and identity, offering them guidance and reassurance. For Havighurst, in infancy and early childhood, these children are learning to walk, talk, and form relationships, and nurses should support these milestones by encouraging physical activity, language development, and social interactions. In middle childhood, they're focusing on developing skills and independence, so nurses can assist by promoting educational activities and self-care practices. Turning to Piaget, in the sensory motor or 2-year stage, knowledge is acquired through sensory experiences, so we as nurses should provide stimuli that promote sensory and motor development. Looking at the concrete operational stage of 7 to 11, the children are beginning logical thinking, so we can use concrete examples and hands-on activities to explain health concepts. Looking at Levinson's life structure theory, the early adult transition from 17 to 22, This phase involves leaving the family home and starting an independent life. So we should support young adults in managing their health independently and making informed decisions. The midlife transition from 40 to 45 is where individuals reassess their life goals. So we can provide counseling and support for lifestyle changes and managing midlife crises. Turning to Kohlberg's moral development in the pre conventional level, moral reasoning is based on external consequences. So we should use clear, concrete language when explaining health consequences to young children. Turning to the post conventional level, morality is based on personal principles. So we should respect and support our patients' ethical beliefs and decisions. In examining Gilligan's theory of moral decisions, looking at the conventional level or goodness, these patients are focusing on caring for others, so we should emphasize the importance of self care along with caring for others, especially in our female patients who may tend to overgive. At the post conventional or nonviolent level, we should promote nonviolence and empathy in all our patient interactions and care practices. For Fowler's faith development, looking at stage one, intuitive projective faith, this is based on stories and images. So we should use simple, comforting stories or symbols when discussing health with young children. Looking at stage six, the universalizing faith, these individuals are seeking to live out universal principles. So we should recognize and support the spiritual and ethical dimensions of patient care. So use age appropriate language and concepts when educating patients about their health. Use simple terms for young children, more complex explanations for adolescents and adults, and tailor their educational materials and support to the developmental stage of the patient. Offer interactive activities for children so they can maybe learn about hygiene, or detailed lifestyle modification plans might be available for adults who are managing chronic conditions. Understanding these developmental theories enables nurses to provide holistic, patient centered care that meets the unique need of individuals at every stage of life. So, we've covered various developmental theories that provide insight into how individuals grow and change throughout their lives. These theories include Freud's psychoanalytic theory, which focuses on the influence of the unconscious mind in early childhood experiences, Erikson's psychosocial development theory, which emphasizes social and cultural influences on development, proposing that individuals pass through 8 stages, each characterized by a different psychological conflict. Havighurst developmental task theory outlines specific tasks that individuals need to accomplish at different life stages to achieve successful development. Piaget's cognitive development theory explains how children acquire knowledge and learn through 4 distinct stages. Levinson's life structure theory focuses on the evolving life structure through major phases, highlighting significant transitions. Kohlberg's moral development theory presents the stages of moral reasoning, while Gilligan's theory of moral development offers a care-based perspective on ethical development from a female viewpoint. And finally, Fowler's faith development theory discusses the stages of spiritual growth. Understanding these developmental stages is crucial for providing effective nursing care. It allows for tailored interventions that align with the patient's developmental needs, ensuring more personalized and effective care. For instance, recognizing the developmental stage of a pediatric patient can guide appropriate communication methods and educational strategies, while understanding the psychosocial stages in adults can aid in addressing emotional and psychological needs. These theories help in predicting potential challenges and planning suitable interventions. They also underscore the importance of considering the whole person, including their psychological, social, moral, and spiritual dimensions. By applying these theories, nursing professionals can enhance their ability to support patients in achieving optimal health and well being throughout their developmental journey.